welcome to the CCC News studio and to our podcast today. We've got the Columbia Gorge Health Council here with Rosie, Katie, and Julia. Welcome back. Hello, everyone.
Thanks for having us.
Yeah, thanks, Robin.
Thanks for coming in. We did this before, but we had a little error, so we're doing it again. And so, excuse us while we go through this conversation again. I think we're pretty good at this, so we're gonna get everything in the second time anyway. So yeah, let's go. Let's start by introducing ourselves and what we do at the Health Council. Do you want to start, Rosie?
Sure, that sounds great. My name is Rosie Strange. I am the Learning and Cultural Development Manager of the Columbia Gorge Health Council. I support a couple of programs, one being Akwash Tubsha Chushna, which is the Native Supports Program of the Columbia Gorge Health Council. And then I also am a lead for the Learning Collaborative, which runs the CHW trainings and other traditional health worker trainings in partnership with Neon and a couple of other orgs that we'll talk about later today.
Cool. Welcome. Katie.
Hey, I'm Katie Williams. I'm the Community Impact Director with the Columbia Gorge Health Council. And I've been there since 2016 and was a part of building the Bridges to Health program, which I think most people are more familiar with than the Health Council, but it's a program of the Health Council. And then other than that, I'm kind of in every aspect of our work in some capacity and working alongside both of these two and a lot of really great community health workers.
Sweet.
Yeah.
Julia.
Yeah. Good morning. Thank you for having us. Julie Becker. I am the Program and Communications Lead for the Bridges to Health program through the Columbia Gorge Health Council. And my pronouns are she, her, and Aya. And I've been with the Health Council for 2 years now almost. So really exciting and happy to be a part of an incredible team doing amazing work. So
yeah, welcome back. The work you guys do is amazing. Let's get into it. So you just got a new grant. That was kind of the impetus to kind of coming back on the show. This grant's supporting community health workers, right?
Yeah.
Tell us about the grant and what it's going to do and like what it's doing already and how it's supporting the work. This is so exciting.
Mm-hmm.
Yeah, a little over a year ago, maybe coming up on 2 years ago, we were asked to join a partnership with an organization that we partner closely with regularly called NEON, or Northeastern Oregon Network. And in that, we started a hub for training community health workers. And we were in partnership with Willamette Valley Health, Mid-Willamette Valley Health.
Mid-Willamette Community Action.
Thank you. Yeah. I don't know why that's so hard to stick with me every time, but in partnership with those three organizations, we came together and created a hub to start expanding community health worker training in the rural space. And so when that grant round ended, we started looking for other ways to continue this work, including building more traditional health worker trainings. And so we partnered with them and a couple of other organizations, which I'll let Katie talk about later because I struggle with those details. But we were just awarded $2.3 million in partnership to continue expanding these trainings, including CHW, or community health worker trainings that can specialize in the medical field. So how to support people in that space more, as well as helping clinicians help understand how to utilize community health workers better, as well as a mental health track, and then continuing to translate all of these trainings into Spanish so we can make them accessible to more people that do this frontline work. We're really excited to be in this partnership and feel like it's the next step in our journey of continuing to support community health workers, not just here in the Columbia Gorge, but regionally, rurally. We are continuing to expand this training capacity. Did I miss anything, Katie?
I don't think so. I mean, maybe the only thing I could add is, like you mentioned, Northeast Oregon Network being a collaborative partner in the project and really just giving them credit for seeing this project through and doing a lot of the hard work of filling out the application and gathering all the budgets and convening the partners to make it all happen. So shout out to them. And then I think aside from us, Neon, Mid-Willamette Community Action Council, and then, or Community Action Partnership, the other big name partner is Oregon Community Health Worker Association, or ORCHWA, that are all involved in the partnership.
So cool. Yeah. And so to take it back, just to go simple level, so the community health workers is kind of supporting training and growth of community health work. And we're in a pretty cool bastion of amazing community health workers, right? Like we kind of lead the region or even the Northwest. So it's the work is really, tell me about where you are in this and like what you, like some of the core work you're doing and how it's impacting folks that live there.
Yeah, I mean, I would love to start us off by saying like we're very fortunate to lead some of the cultural like inclusivity and diversity like that represents our team. We make up largely of BIPOC individuals with lived experience. And so I think that really kind of becomes and paves like the way for our work and how we provide care and service to our clients and families and community. And so I think that's one of the neat parts about maybe how we model this work and really just taking that lens of understanding that cultural experience plays into this work, and it's important to represent that.
Yeah. Yeah. So the community health workers, they go out into the community and they help connect folks to resources, right? That otherwise it's hard to get connected to.
Yeah.
You know, you need a lot of things sometimes. You know, you go to the hospital and they've got a long form for you, right?
Yeah.
And like all of those things they're listing assets in a way, address, phone, email, like, and all those other things. These are assets that we live with. And if you're living without those assets or without those tools, like an address or a phone or an email address, it's pretty hard to get services.
Yeah, I think a lot of people don't realize how challenging that is. Prior to this work as a community health worker, I was working in family practices throughout the gorge for about 15 years. So supporting people in a healthcare system, like as a medical assistant, and supporting doctors and helping make treatment plans, right? Like helping them understand what a client needs. But my care ended at the door. I didn't get to help the patient figure out getting their prescriptions or making sure they're getting to their referrals. Or, I mean, sometimes I was working with elders that were like, I'm working 3 jobs, and the reason my diabetes is out of whack is because I'm sleeping in my car 3 days a week. And providers don't always have the time with all of their casework to be able to make that connection with patients. And so as a medical assistant, I was doing that, but then my service ended at the door. I always felt like something needed to be between the doctor and the community. And then about a year after I left the healthcare system, burning out during COVID, I applied for a job to become actually a youth outreach worker. And then I got through 2 interviews and was finally told, like, we're going to actually go with someone else for this role, but we think you would be really great at being a community health worker. What do you think about that? And I'm like, what is a community health worker? And so then I learned a little bit more about it. And initially I was like, I don't want to work in healthcare until there's Medicare for all, because it's really draining work. But this felt like such a special way to get people to have their healthcare utilized in the best way to their fullest ability. And that's a lot of what community health workers do through our program. We connect them to their health insurance and utilize their health insurance to help lower their healthcare costs overall, helping them access community resources or maybe wraparound supports that certain Medicaid or Pacific Source could offer them during certain programmings. But yeah, we do direct outreach. The Native program, we do direct outreach to the fishing in-lieu sites throughout the Columbia River to access people that are living there, sometimes without running water or electricity, and supporting them in accessing resources like transportation, housing, medical care, food, mental health resources, anything that we can help connect people to help them stabilize themselves and help them feel like they're in control of their life and their choices in the healthcare realm or in their life realm. Just help them build to the most stability that they can.
And I think one of the really neat parts about the way our program is structured is we go through pathways, and we have a pathways model. And, other programs where they have maybe more of a criteria to follow to get families through stability and exiting the program, One of the special things about Bridges to Health is that we're able to really work with families and clients for as long as we need to. And we help them really by meeting them where they're at. And so in their life, if things come up like along the way as we're walking and working with them, I think that we, always assist and address those and are willing to work with someone as long as it'll take to help them get to what stability looks like for them. And really taking like a trauma-informed lens approach to the way we do client care is understanding that that's going to look different for every person, individual, and family.
Yeah. To go back to what you said before, you mentioned that the big part of the team is BIPOC and has lived experience. And so how is that important in this work of reaching out to families and helping them? Like, how is that cultural relevance important?
Yeah, I think a lot of, even in the like Mexican, Latino family world, like there are so many different variations to areas where you originate from. Maybe you migrated here, maybe, you're seeking asylum here, depending on what that is. Most of our, Latino Mexican community health workers are bilingual, and so they speak Spanish and can help to assess clients in a language that's culturally like sensitive. And even if that's not the case, there's always room for us to be able to understand and meet clients. So I think if we, maybe one of us doesn't speak that language, we're always willing to connect them with like appropriate care. But I think it plays an important role in the way that you're able to provide services. Families feel like they are able to communicate and advocate for themselves if they can communicate with you in their spoken language. And so it's a really beautiful thing to do that, like in the clinical realm, like as Rosie was saying, like across the medical world, but also just in community. Sometimes like our area is really special, so it looks different when you live here. So navigating those resources in your primary language is very vital and extremely important. So
I think it's also the essence of community health work. Like you were pointing to, we have like a rich history of community health work here in the Columbia Gorge. We were just a part of a project around a documentary about the history of community health work. And we have been doing community health work in the Columbia River Gorge since like the early 80s. That's when programming started to form around people. Otherwise, community health workers have been doing this frontline work, meeting communities where they're at since forever, since time of memoriam. Families have been needing support, and these were previously in previous cultural places like the medicine people and the people that connected people to resources. But truly, the history here in the Gorge started in like the 80s with La Clínica de Cariño, currently known as One Community Health. They started doing outreach to the orchards and migrant camps to try to support families in accessing healthcare, recognizing that children were not getting regular medical screenings. And that very much connects to my history in this community. I engaged in those programs as children. I was born and raised here in the Columbia River Gorge. This is also my ancestral homeland as an Indigenous person, and it feels just so powerful to recognize that history. Because for so many reasons, I get to work with these powerhouse people that have been doing community work since I was a child here. And it feels like it's almost a time of like handing a baton in a different way. And then I feel like I'm doing that for other community health workers coming behind me now, trying to advocate for systems to train community health workers in a way that feels connected to those cultural pieces, as well as advocating in these healthcare systems. Getting to be really closely working with Pacific Source is such an honor to be able to tell them like that makes sense on paper. Also culturally or like community wise, people aren't going to want to engage with that. And here's how we can do it differently so more people will want to engage and access resources that they need, but also have rights and privy to. So yeah.
Yeah, going to like the history of like the community health work. One of the things that I think is really neat, like for most of us that have stayed in community and have been here for generations, is that a lot of us, without realizing, we're navigators of these systems, like as children. So, like especially a lot of the people that we get to work with, we're the translator in their family and helping their parents get connected to resources. And so we have kind of like fostered this kind of organic environment of this community health worker realm and region by doing so, since advocating at a very young age, engaging in these services. So now we see that like with the community health worker training, we actually have those children like who are enrolled that are becoming community health workers. And speaking to that history, what's really cool is like passing the baton. My mom was a community health worker before me, so I'm preceding that work. And so it's kind of just following in those footsteps and being able to, like you said, pass on the baton, and we're helping to create like the next generation of community health workers. And it's very inspiring work, especially because a lot of us have just done this since we were children. And so it's meaningful.
Yeah. Yeah. It's cool. There's such a need, right? Like, and it's not people having this need forever, right? We're going through moving things, right? And like there's once you can ground yourself, there's opportunity, and it doesn't always work. Sometimes it takes a few rounds, and that's okay, right? But like, the numbers show that there's a need, right? Like the number of folks, like at the annex, for instance, and when we go to the annex, they just put a new playground up. Like why which is really amazing that they've got a playground, but it's also like makes me aware of like how many children are in that situation in our community that need a playground while they're going through that situation, right? It's just like a little flag about what's going on there, because these stories are so individual, they're so unique, these are hard stories to hold, to listen, for people to tell, right? And so we don't hear them, right? For many reasons, right? But there's so much need here. When we talk about the Native community, we have a whole Native community under the enormous hydroelectric dam over there that doesn't have access to electricity. Like the whole community, and like there's like the sun blocks the dam sometimes. The dam blocks the sun. Excuse me. Right? Like it's true, right?
It's true.
And so, like the need is it's hidden sometimes, and so. There's not just navigation for those people out of it, but us navigating for the help to be able to engage with it. And that sounds like what you guys are doing.
One of the important things that I like really want to highlight with Rosie and Martin, who are supporting our native programming, is like when talking about the Inlu side specifically, one of the things that came up recently was that they don't have a mailing address. So when you don't have a mailing address, and this applies also to our houseless community, but when you don't have a mailing address, it makes it really challenging to get things like a driver's license or an identification card, or to have services delivered to you because you don't have a permanent residence. And so that highlights like some of the need, like where the community health workers can bridge some of the disparity, is we actually can go out and be able to provide like some sort of, permanent residence, or can we somehow work a loophole so that you can get this ID card so that you're not going around without that, and so that you can operate your car to get to the job, to get to, to have income. So I think it's addressing those gaps like within our system that make it really challenging to find any sort of stability.
Yeah. And the Native folks, these are displaced folks, right? Like there used to be a river here and now there's a lake, right? And those villages were displaced when the lake, the gorge was flooded to make Lake Salilo, and the agreement, the treaty was for all the people that lost their homes, we're going to have houses rebuilt by the Army Corps of Engineers, of course. They rebuilt many of the white people's homes, but they didn't rebuild the Native folks' homes, right? And so these folks are victims of that displacement that we see every day and use the electricity of every day, right? And this is recent history, right? This is 60 years, 70 years, right? This is not a long time, right? It takes a long time to recover from a great displacement. Right. And when we have big barriers in place, like you just described, right? Like where, like now you've been displaced to a place, but the place that they've displaced you to doesn't have a real address, so you can't have a driver's license.
Yeah.
Like literally that exact scenario is playing out right here locally, right? And these are rules that we've described, right? There's the rules that like humans have created to create these barriers, and like jumping over these barriers requires work and like people standing up for folks that are going through this, and they're going through it today. Like
Yeah.
this is not hypothetical. Like it's been going on since they were displaced,
Totally.
right? And there has been some rebuilding in Wishram from the Yakima housing thing, which has been cool. But there are still many families that are still just like out of a house that used to be there.
I mean, there's also a ton of families who've never had housing. I will say that, like, a lot of the people I work with have never recovered generationally, lineage wise. And that is exactly why they're in the situations they're in currently. But it's hard because this culture doesn't want to slow down to acknowledge that. Like you said, like people are benefiting from the benefits of that electricity. And I, as an Indigenous person here on this land, often feel like, do people even know? And most people don't. And I feel proud of the work that we've done in my programming, Akweshtupsha Chushna, our programming, and then also community-wise, like the Next Door Incorporated formed a Native Supports Program back at the start of the pandemic and really worked hard to bring together people that serve Native people and want to serve Native people to try to bridge that gap. And that is actually where my role started at the Next Door. And then we realized that there's enough need for more than one program. And now there are multiple Native programs that are supporting Native people. And growing up here on the river, I was always told, our families were always told, go back to your reservation. That's where your services are. And so with the pandemic, COVID, like that really opened up people's eyes to realize like, our reservations aren't able to serve us often because we are living here on the river, which is actually our ancestral homeland, and has things we've been promised for generations, let alone like there's barriers to accessing that. Native people don't view the Columbia River or the Nichiwana, our traditional name for it, as a dividing point. Natives are moving across that river all the time. And so that can be really challenging for an address. And that's been our cultural way forever. And it's important for the system to understand that. And it's been really, I think it's been a changing path since the formation of Gorge Native American Coalition collaboration to really identify that and point that out to social service systems that we need to figure out ways to bridge to Indigenous people. And we've really been doing that through the program work in the last 6-7 years, it feels like. But yeah, there are deep wounds there for generations of families. It's a lot of the conversations I have to have with people to remind them that it's not their fault. Like, we have been dealt this card through colonization and the genocide of our traditional ways, the genocide of our land. And it makes sense why it's hard for us to fit into current systems. They're not made for us. And at times they've been built to oppress us. And so it feels really powerful to get to be in this place, to be able to advocate in a way that creates systemic change for people and highlight that sounds great on paper, but isn't actually meeting people where they need. And you do actually have a responsibility to care for those people in a way that suits them and supports them.
Yeah, and speaking also to that displacement, like most recently, like with the fires, specifically like the Confederated Tribes of Warm Springs, and just, with so much land burning, that is their land, they've been displaced, and there are ways to donate. And so I wanted to give Rosie a chance to talk about that. But
Yeah.
If folks don't know, there have been massive fires on both sides of the river, which most people that live on the river are either Yakima or Warm Springs, Umatilla, or Nez Perce, so further down the river. But with the fires on Yakima Nation and Warm Springs tribal land, there will be people that are displaced that will be coming to the river, let alone it's fishing season. So there are people here on the river. But we have shared on our social medias recent ways to donate to both of those tribal entities that is getting to people on the ground on the reservation. Last I heard on Warm Springs Reservation, which is my tribal enrollment reservation, we lost 7 houses. I mean, the Oregonian just put out an article like in the last 2 weeks that highlighted this is going to take tens of years for both of these tribal entities to recover from. And that's just money, capitalism wise. Like that's not even counting like the damage to the land. And as Indigenous people, we feel that, we grieve that, we feel the pain of the suffering. And yeah.
Yeah, if you are someone that is interested in donating, you can go visit our Facebook page, the Columbia Gorge Health Council, and donate to those 2 tribes that have had obviously a extreme disparity and loss. And so if you are in a place to do that, that would be amazing.
Check the link in the description. We'll put those links in our article so you can get links to that.
And if these kind of conversations are something you're interested in, this is the type of stuff we talk about as we move through our community health worker certification trainings. Really pulling back the layers of why people are in the situations they're in and the challenges and barriers that they face, to expose the reality that so many people are living in. And I just, in hearing both of you talk, I think about so many common, it's hard for people in our type of work who are on the front lines and see the things that are going on, to hear comments around like, whether it be just the misconceptions of why people might be houseless or struggling or going without as though it's a choice or it's an easier life or there's less responsibility or whatever that might be. But the truth is it's not an easy life, and nobody actually wants to be houseless. Nobody wants to go without food. Nobody wants to not have transportation. That's not real. And if it were easy to not have those disparities, people wouldn't. So those are the kind of conversations that we have in our trainings.
Oh, yeah. On that note, if you're interested in becoming a community health worker, we do have a training launching coming up here in the fall. Right. I think we start the 3rd week in September, and it's a 20-session training, but you walk away with the ability to get certified through the Oregon Health Authority and become a traditional health worker or a THW, and with the specific title of community health worker. There are scholarships available through the Rural Health Office here in Oregon. We're looking for people that have these intersecting pieces of their personality. We're looking for queer, Indigenous, people of color who want to be in community work, want to be supporting people that are facing disparities that we know exist in our community and helping them stabilize themselves. And I mean, truly using your own personal story, right? You've heard me and Julia today talk about like, we bring ourselves to this work because we need to see ourselves in this work. These systems have traditionally been oppressive to some people. And I think this is a lot of our focus, is trying to create more just systems that can really meet people where they're at and help them see their own power and strength.
Yeah, and I think on that point, like, Katie Williams, Jenny England, both of our directors, and I think just having that support, giving the platform that BIPOC people should be leading this work, lived experience people should be living that, like, leading this work, and highlighting like what Katie said. People are in these positions and in these situations not by choice. And it's, systemic oppression. It's different systems that have worked against people for a very long time. Yeah. And I think we really understand that. And so one of the things we regionally kind of do in our community is we have the CHW Collaborative, which is a makeup of team who have been doing this work, community health workers in our area. We convene about every quarter. And the point of that is for us to really learn from each other, but be in a space with also really affirming people, where you're in a space with people who do have lived experience, who are BIPOC, who might be queer, who might have this lens of the world that is not really given the platform to shine. And so we're in this space and we learn from each other. And through the CHW, the learning cohort that we're doing and launching in the fall, we can bring newcomers into that space to learn from their elders and to learn for people that have been doing this work in the community for a very long time. And it's always ebb and flowing and it's changing. And like with the, hyper focus right now, especially on mental and like behavioral health work, like the importance of understanding that why people show up as they do and like not just being trauma informed for like the token of the word, but like actually really understanding what that means and why it's important and how it affects the way someone shows up in their life and also the way they show up for others. So that's one of the things we've really just been able to foster and grow in this work as we lead through it. So, yeah.
And as I understand it, it's a pretty cool pathway, right? Like there are many pathways to, careers that both meet a person's sense of purpose, but also, financial basis and also, and meet all the things. And when the more education shows, the more education you have, like the easier that is to find and maintain, right? But the education is expensive to get, right? Like college degrees are very expensive. Ask me how I know. And like for everyone, right? It's across the board. But there's a pathway here. Tell us about the pathway. Tell us where it can take people. It's a great place to start, right? Because you can start with a high school diploma.
You totally could. It's that special. We want people who don't have college degrees, who have never had access to those spaces, joining us in this training. I don't have an associate's degree. I don't have any college level degree. I have a certificate in medical assisting. And in previous healthcare systems, that really didn't take you anywhere. You really needed to have an associate's degree, like maybe even a bachelor's degree or a specialized training program like nursing or CNA work, nursing assistance work, and to go anywhere in the healthcare system. And then often it took years to start building your way into different pathways. And that's always been our hope and dream of expanding training, is helping people access more higher, more equitable paying jobs. It's our hope for the Learning Collaborative is to build a pathway for high school students to be able to join us in this work. We really acknowledge that youth are our future and should see themselves in community work and not have to go to college and attain a bunch of debt to start doing that work, or sometimes leave our community and go try to build a life somewhere else and then go, wait, I actually want to go back home. And I think that was a hope of our dream of building the Learning Collaborative, and is some of our work with the Mental Health Consortium is to build pathways for people to hire licensures to keep supporting community work and make it easier for people that don't have generational wealth, that don't have that frequently face the barriers of systemic oppression, that are instantly told no when they should be considered, especially with how much heart they give to the work. And
you could start. So you could start with this, with community health work, right? You can go to addiction counseling. You can go from there. You can go to like behavioral health, stuff, and then you can get mentoring, supervision, right? And you can end up as doctor on this pathway, right? And people do, right?
Yeah, the community health worker, like just training itself, the model of it, it's ironic because also there's people that have, like on our team, that have bachelor degrees and, have gone through school and did nursing and tried all the things and then still came back to this very service role oriented style of not only leadership but also work. And it's like sometimes you do a lot of learning to unlearn some things because you're in this system. And so one of the things that I think is cool about the community health worker training is that there are different people from different walks of life that have either gone and decided like, I don't really love that. I think I want to go back to like a grassroots operation. Like I want to be on the ground in community. And that was really like my focus, having grown up in this community and having gone to school and then moving back because I wanted to really service this community. This is where my heart is. I was previously a case manager and qualified mental health associate and have done all the things and worked with youth and families and work in the hospital setting and done all of the rural work, right? But I was like, there's something about community health work that it can either be an end point and you do this for your life and it's extremely fulfilling, or it can be a jumping point. And it depends on what that pathway looks like for you. But I think that's kind of some of the creative model of like what we're doing here is that it leaves that person in this role to really be able to decide, like, do I want to make this work, keep it maybe homegrown, like I want to be a QMHA or a CHW like in this community, or is this like I want to learn first and then go off and maybe go through that mental behavioral health pathway. But I'm really really trying to push, like, we're the direct service providers, we're the ones that are doing the home visits, and we're the ones in community, and we're the ones seeing the reality. And so there's a special lens to be able to have, some mental and behavioral health training, like suicide training or crisis intervention, like under your belt. Both because this work is also secondary, like it's secondary trauma. Like it can also be first, like, direct trauma. So it's important that we're also equipped and like have our leaders and also elders guiding us through this work.
You are right, though. People have started in community work and worked their way up to doctor level, I'll say. Clara de Leon started with one La Clínica de Cariño, now currently one community health, way back in the 80s as I think a CHW and then eventually a medical assistant. And then eventually she is now a physician's assistant here in our community, still working, I think, in orthopedics now, but she is a great representation of what accessing this level of work can do to a career path. And also your commitment and heart to community work. I mean, so powerful.
The only thing I would add too, is that many people on our team and many people that end up in community health work, not all, but many, have maybe struggled with traditional school setting. And this is a different style of learning. We utilize what's called popular education, which is really like a core aspect of community health work. So it really takes everyone's experience into consideration and encourages everyone to participate in their learning. Really, we're facilitators of the space, and we hope to bring in like rich conversation where everybody learns from each other. And I think the other thing is like all these levels of work are valid, including being a community health worker for the rest of your life, maybe moving into a senior community health worker role or getting specialties like dual certification. Maybe you're end of life doula or a birth doula and a community health worker. And the Health Council's also done a lot of work in creating like a, what's the word? Livable wage, livable wage for people doing community health work, because it's important work and should be recognized for how challenging it is and how important it is in our community. And then hopefully that will kind of spread into other organizations too. One reason might be because it'll get competitive, right? Like what you pay will bring people to your door. So we advocate for that.
Yeah. Well, great way to get paid while you learn and do a a career that has purpose and meaningful work in the community that you're in, and there's so much work to do out there. I spent a day with Nick on the lead program, and
great.
that was an eye-opening thing. We released a video with the Hood River Sheriff's Department. If folks are interested in watching that, it kind of gets into that a little bit of what that stuff. That's diversion, but he's going out meeting people that are camping and stuff. Good example. Let's look at some basic examples. If you go camping for the weekend and figure out how long it takes you to get from getting up to like feeling like you're ready to go and like go to the store or go shopping or something, it takes a long time, right? Like when you're camping, there's so much effort involved. I call it poor tax, right? It takes a long time to get yourself ready. Where in your house, you've got the bathroom next to the bedroom, you just pop in the bathroom, wash yourself off, you get done in 30 minutes, 40 minutes, right? And you're out the door, be ready to work. But when you're living in these situations, everything is harder.
Everything
becomes harder, right? And so these are just a small, think of just for ourselves, right? Just if you put yourself in those shoes, that's probably one of the closest things that we get to that, and thinking about how much effort it is. I just got off a week of camping. God, it was so much effort just getting out the door in the morning and then coming back and getting yourself some building dinner and stuff. And it's
People
a lot.
have no idea. It makes me think of a project that I'm honored to work on and actually just got called back to this year. Mid-Columbia Community Action Council has their annual Houseless Summit coming up in November. And one of the sessions that I've run for the last couple of years has been a day in the life of houselessness. So here in the Gorge, people think that houselessness doesn't exist or it's just the houseless person you see on the corner or on the sidewalk. But houselessness is very complex for a multitude of people. But those stories tell that essence. In the beginning, it started out as more anonymous stories, and now it's really started to turn into real stories. And they are really complex. Like you think that you're far away from houselessness, and you're not. These are stories of people with full-time jobs that had an injury, that missed one paycheck, that missed one rent payment, and it cascaded their life into something else. But there are also stories of generational poverty, Indigenous people that have never had stability and are trying to survive in this world, coming to the INLU sites at different times for the only space they're allowed to be. And then others are like families with children that just never could recover from specific things. But there are a lot of poor tax that people don't think of. In order to get on the bus, you need to be able to carry everything you're bringing on the bus. And if you're a mother trying to go grocery shopping for a family of 4, that's more than 2 bags of groceries. And let alone like the round trip time of like maybe you went over to Hood River from the Dalles. That's going to be a 6 to 8 hour turnaround. How are you going to be back in time to pick up your child from school? How are you going to be back in time to make it to your night job? Or there's no bus system running at night. How do you get to your night job? Like these are complex things that I think people don't recognize until they're in the situation or connected closely to someone who's going through it. So
and it can also look like being freezing cold. Maybe you're sleeping outside, maybe you're sleeping in a dilapidated trailer without any running water, no electricity. You don't have anywhere to keep your medications cold. You're having to hike in with very poor shoes, 10 miles one way and then 10 miles back. I think it's just recognizing like that poor tax, like how hard that life is, and no one chooses to be in that position.
No.
And so I think that's really where we come in to be able to bridge some of the inequity and really be honestly someone's lifeline. I was on the phone with a gentleman that fell while I was on the phone with him and called EMS. He had no other family.
Wow.
And so I think it's just like sometimes you really are the line between high risk and possible death and someone being somewhat connected to a life-saving resource. And so I think it's really like, especially with our DV clients, like, you know, domestic violence clients, like the severity and intensity and also just sensitivity in those cases.
Yeah.
Someone texting me a code word telling me I need someone to call police right now, or this is my situation. You are that person.
Yeah.
You're so intertwined. And so it's really also like equipping ourselves with being able to navigate that as well. Because a lot of it is also because we come from lived experience. Some of these are situations that we've been in and we're watching our clients and families go through as well.
It's no easy to watch because you're getting paid, right?
No.
It's just as traumatic.
Yeah.
We're doing our best to support them through, and yeah, it's a very interesting time in our work. But this is going back to where we started, the essence of community health work. Historically, community health workers have been at the front lines of political unrest since the beginning too.
Yeah.
It's some of what we teach in the training too. Community health workers have been facing systemic problems forever. They're the people that are the helpers and the shower uppers, like every time. And I think I keep finding myself in the same circles of people that I've been doing community work with forever. It's really special and really powerful, and really grateful to be a part of it here in the Gorge. It's my ancestral homeland, and it feels like some of my ancestral calling to do this work and support more people joining the work too.
So cool.
Yeah.
Yeah. So, just to recap, there's a training happening in the fall. Get in touch with you guys if you want to join that.
Yeah.
cghealthcouncil.org.
Yeah.
And you're going to have some little application there, I'm sure, if some more information or
Yeah.
something. And look out for you guys on the streets. Donate. So you have the propane bank and the other ones. So drop us a little pitch for that stuff.
We will.
Yeah.
So another thing that we noticed in the work, I've been doing this work with natives for about 5 years. And in that, every year in our community, we do low income energy assistance programming. LIHEAP, as some people know it. And people with houses apply too, but native folks apply frequently. And in that, I was recognizing that natives were applying in October and not getting their funds until sometimes December or January, which, as we know, if you live here in the Gorge, it gets cold. It gets pretty cold.
Yeah,
and if you're living in a trailer without electricity, that means that utility check is your propane money. And so I helped create a mutual aid bank where people donate and we distribute new propane tanks. We trade them for their old ones. So we're getting the old, probably misfiring propane tanks out of community and giving them a new propane tank that's full, as well as like safety supplies like fire extinguishers, carbon monoxide detectors, and then education to like the risks and safety pieces for propane. But we do that outreach through the fall and winter to support Native people until they can get that energy assistance check to hold them over. If you're interested in donating, we can put that plug in the bio too.
Yeah, it's on your website too.
Yes.
Right? Yeah.
There's a donation button there. We also you can find us on Instagram and Facebook too. Keep up with what we're doing. The posts are pretty up to date with what we have going on. And then I would one more plug. If this is the kind of work that you're interested in being a part of and you're a community member, in particular, if you are receiving organ health plan or Medicaid, we have a consumer advisory council. So for consumers of OHP, we want you at the table. If this is something, if you want to share your experience, you want to have a voice back to OHP providers, like for our area, that specific source, to say like what's working well, what you feel like could make these services better. And also what's going on in the community, where we invest funds. Come and join us. And you can find information about that on our website too.
what a great opportunity to tell the medical providers what to do. That sounds lovely.
Yeah.
Help us.
Yeah? Can I come? Yeah.
Yes.
Yeah, that sounds great. You know, obviously, it's the person you're providing, right? When you go to the doctor and it's just like chaosly annoying, but the person you're providing, they're always really nice. And I'm always nice to them, right? You know, and you can recognize that they're in a system that's so flawed on so many levels, you know. They used some choice words for me on my medical chart, but it wasn't because that was rude. It was just because the medical chart system was all broken, right? And so that's a wonderful, wonderful, wonderful opportunity. Thank you. Is to tell them in a constructive way that allows that feedback to get to the people that are choosing and deciding on those systems of care, right? Not just the doctor who's not building the systems of care, but providing the care, right? Which is a different thing. So it's because it's such a disconnect between the person that you're seeing versus the person that made the system.
Yeah.
You know, there's like such a disconnect, and even those doctors only get so much opportunity to feedback to their systems too. Even if they see it better, doesn't mean they can change it. Right. So, but that is the opportunity to do that. So jump on board.
Yeah, and I just want to plug in like our incredible partners that help us in this work. Like we are so supported by other amazing orgs that are doing, you know, similar, if not a lot of cross-sector work. Like Mid-Columbia Action Council is a very close partner. If you don't know how to get connected to these services, I think visiting the Gloria is a really great place to start.
Yeah.
And then from there, the gals at the front can definitely help to get you well connected into what you're looking for.
Yeah, so that's the Gloria Center on 6th Street, right?
Yeah.
Or 7th
Street.
Street. It's kind of behind the cinema and like where the
Behind
cinema used to be.
Coastal.
Behind Coastal. Yeah, it's obvious once you're on
Yeah.
that street. It's the only thing there.
It's 2505 West 7th Street in the Dalles, Oregon. So for those that are not quite sure where to go, that is an amazing hub full of incredible people, not just professionals, like people that will help and are willing to go the extra mile. So
Yeah, that's great, and much easier than trying to figure it out on your own. Go see some folks, just go talk to them, make an appointment if they're busy. And
if you're hot or cold or need anything, especially the free store on Sundays, like please come see us.
Yeah.
Well, thanks so much for coming. Did we miss anything?
I don't think so. I think we talked about everything we wanted to.
Great. Okay, amazing. Well, thanks so much for coming in again. Really appreciate you being here to share all this really great information with us. And remember to like and subscribe and check out the description for the links to stuff. Propane's, providing 1 5-gallon propane costs like $15-20 or something. That can change someone's entire month, right? And does, right, consistently.
Come meet with us. Let us know if you have questions or if you have interesting program ideas. We love ideas too.
Yes. And if you want to scope us out beforehand, check out our social media. If you just want to scope us out first.
Thank you for having us.
Thank you.
Thanks for coming on.
Thanks, Robin.
Yeah, great.